If you live in the state of Georgia and you're offered SHBP as your retiree health plan, should you take it or not? We're going to take a look at that. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. All right, about 4 years ago, I did another video on SHBP, and it's gotten several hundred views. And I get calls all the time from folks who have that same question. Should I take the SHBP plan or should I do something else? And I'm not going to tell you, I don't tell them, but I'm not going to tell you what you should do. But I will give you some things to think about that maybe you hadn't considered, and maybe it was explained to you differently. So anyway, one of the things that you need to look at is access to health care. Now, this is not just something that's limited to SHBP. Any managed care plan, any PPO or HMO plan will always have some kind of limitation as to which providers you can use and which ones you can't. So maybe that's a concern with you, maybe it's not. But let me tell you about a real life situation that came up last year. A lady called me. She currently worked for the state. She had SHBP. She'd had it for a number of years, covering her and her husband under the plan. And she said, well, I'm about to retire, and right now I'm being treated for cancer for the second time in the last 10 years, I think it was. And both times I had to go. I didn't have to go. I did go, opted to go to MD Anderson in Texas. They're the best in the nation, so at least that's my opinion. They're best in the nation for treating cancer. And so I went out there, and I was out there just a couple of weeks ago for some follow-up testing and so forth. And the person that I was talking to in the office there said, well, I notice that you're nearing retirement. Have you thought about your post-retirement health insurance? And the lady said, well, yeah, I plan on just continuing with SHBP. And that's when she was told, well, you can't come back here if you have that SHBP retiree Medicare Advantage plan, because we don't accept that. So she was quite taken back by that comment. And what you'll find with not just SHBP, but a lot of Medicare Advantage plans, there are some specialty hospitals, especially in treating cancer and so forth. There are some specialty hospitals that do not take any Medicare Advantage plans, or they may only take one or two, and the one that you've got or the one that you're looking at is not one that they take. So it's something to consider. Now, if you have original Medicare and a supplement plan, you can go anywhere. All the hospitals that, all the hospitals take original Medicare. If they take original Medicare, they'll also take your supplement plan. So it's not going to be a problem. You've got basically unfettered access to health care anywhere in the country, which is something that you won't have with a Medicare Advantage plan like the SHBP. So continuity of coverage is something that is important to you, or just being able to have access to some of the best treatment centers in the country, then you may want to look at your options with original Medicare and a supplement plan, and then make your decision. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.